So the same with the immersive dummies that we use. It's the same even when we're just using body parts during the sim labs, because obviously when you're in practice, you're going to still want to be interacting with your patient, you want to be respectful, you want to gain consent. So we try to keep it as realistic as possible when we're doing procedures in here ready for when we go into practice. So we'd still ask to gain consent, and then hence why we've got the Inco on the top covering up. So we'll only lift the Inco up to as far as it needs to be, because this is exactly what you'd do when you're in practice. You'd keep someone as covered as possible to maintain their dignity.
Yeah, so throughout the process, obviously we'll keep checking that the patient's okay, and we'll have got our trolley ready before we lift the Inco sheet. We've both washed our hands, we've put on our PPE, so our gloves and our aprons. We're using non-sterile gloves to start with. We've got our antibacterial hand gel, and then we've got all of the equipment on the bottom of the trolley to keep the top of the trolley sterile. And then we'll talk you through the procedure.
Okay.
So we'll open everything up first onto the trolley.
We've got a sterile one in there, haven't we? Yeah.
So we're just making sure that anything that we open doesn't touch the sterile area. So anything that we've got that's dirty, we're putting back underneath.
There you go, yeah. Okay.
Sharon has given us the consent to do the catheters.
So we've just took off our gloves because we've now got a sterile field. So we're going to clean our hands again with antibacterial gel, and then we're going to put a pair of sterile gloves on. So it can be really tricky if you've not used the sterile gloves before, because there's a specific way you need to put them on. Where you don't touch the outside of the glove, because then you're breaking the sterile field. There'll be so many times where you will do it and it will go wrong, but that's the point of doing the sim. It's practicing. So when we go out onto your placements and when you are carrying out procedures, you can do it safely. My gloves aren't sterile because I'll be standing outside while Kayla carries on with the procedure. Okay.
Right, so we're just going to clean the area now. Okay, Sharon, so we're just going to insert some gel now, which will help numb the area to make the procedure more comfortable. Okay, so you'll feel some slight pressure. Okay, we're just going to give that a couple of minutes to work, and whilst we're doing that, we can change our gloves to sterile gloves.
As Kayla mentioned before, while we're doing the procedure, we'd be talking to Sharon throughout. We'd be asking how she's feeling, to monitor if she's in any pain or any discomfort while we're doing a catheter insertion as well. I hate putting these gloves on.
Normally,
it's an acquired skill.
If you find the thumb.
Yeah, find the thumb and you can get the rest on. Are you ready for me to lift the Inco back up a bit?
Okay, Sharon, so we're going to insert your catheter for you now. Okay, so we're just going to pop the dish down here with the patient's consent when we put the catheter in. When we know it's in the right place, the mannequin will replicate urine coming out, so it's really good. So we take off the end.
Yeah.
And we're not touching the end, that's sterile, so we're going to feed it through whilst not touching the equipment. So Sharon, I'm just going to pop your catheter in now. Might be slightly uncomfortable, but it shouldn't be painful. No pressure.
So whilst I'm here, I'll be observing Kayla's technique, and I'll be monitoring the patient at the same time, again, to be looking if she's in any discomfort or any pain, so we can stop the procedure if need be.
Okay, so we've got some fluid in the bag, so we know that it's in the right place. So we're just going to inflate the balloon with 10 mils of the solution. And then we can attach the bag. Okay. And that's all done, Sharon.
When we've put the solution in at 10 ml, we do it to make sure that it holds the catheter in place. So we just have to really gently pull on the catheter just to check there's no movement.
And then we can check the patient's okay, clear all the equipment off and make sure that we wash and clean our hands after.
So now we've done the procedure, we're going to document that we've both done this together, and we document what time the catheter's been put in as well, and then we'd hand over to the rest of the nursing team and the healthcare staff that catheter's in, so we can measure urine output now.